Hello everyone, welcome back to my channel. I'm Sandrina Tien, your health and wellness resource to help you or a loved one who may be struggling due to illness. Today's topic is inspired by some recent conversations that I've had with people that have been having issues getting necessary medications from the pharmacy. Picture this scenario. You go to the pharmacy after your doctor prescribes you a medication. You go to pick it up only to find that it's not covered. So what do? So in this video, I'm going to be offering tips to help you in the event that you or your loved one may not be able to get the necessary medication that you need that is being prescribed by a provider. Keep in mind, this could be for a number of different issues. Commonly, some of these issues could be, although you may have healthcare insurance, your particular coverage does not include prescription drug coverage. Or perhaps you do have healthcare coverage, however, for whatever reason, despite you having a prescription plan, the particular medication that your provider has prescribed is not covered in your network. Another issue could be that maybe you have no access to healthcare insurance. So in this video, I'm offering some options that can possibly help you or a loved one who may be struggling with any of these possible issues. Before we begin, I'd like to remind you, if you haven't already, to subscribe to my channel so that you can be notified as to when I upload new videos. Now let's get into it. So imagine this, you go to the pharmacy after your doctor has prescribed you a new medication. You go there only to find out it's not covered. I highly recommend you want to talk to the pharmacy. Although they may not recommend another medication, they may be able to tell you, well, this specific drug is not covered because of XYZ, and maybe they can suggest you talk to your provider to find out if there's an alternative medication within that same drug category that you may be able to obtain that might be covered or less expensive. Which brings me to my next point. When it comes to the expense of medication, a lot of times medications are prescribed and you want to get it, you need to get it immediately, or in a scenario where you end up paying a significant amount of money out of pocket. And I find that for a lot of reasons, this could be extremely overwhelming and stressful. I mean, there's certain medications that I find that are way more expensive than other drugs. For example, these are medications like insulin, cardiac medications, pulmonary medications, all these different types of drugs in these particular categories or classifications. They tend to be on the higher end as far as cost goes, that you talk to your pharmacist and finding out why a particular medication is not covered, because they can offer a lot of insight, and although they may not recommend an alternative medication, they may be able to get in contact with your provider to explore the reasons why this particular medication is not being covered, and between them and your doctor, they may come up with some sort of an alternative medication that might be covered or may even be less expensive, costing you less out of pocket financially. Another reason why I encourage people to talk to their pharmacist is because your pharmacist may be able to tell you whether or not a particular medication is not covered because it needs prior authorization or prior approval, which often, actually not often, always, prior approval is needed from your doctor. So what that basically means is that if you have been prescribed a medication that requires prior approval, it's important that you talk to your doctor about filling out the necessary paperwork. They may not realize that until after the fact, after you've gone to the pharmacy, which can be very frustrating because maybe it's a Friday and your doctor his or her office hours are no longer in practice because, you know, it's the weekend, or maybe your doctor has a office in another location and the location that you normally go to is not open, but then your doctor is in another location, and that that pharmacist may be talking to one location, not being able to speak with your doctor because the doctor is at this alternative place, and so on and so on. You get my point. But it gets to be very, very frustrating. So I highly encourage you to talk with your pharmacist, because they'll be able to tell you that. And if that's the case, then you can get on the phone with your doctor and talking to possibly a covering person or someone in the office that is able to connect with your provider directly and getting you the prior approval if that is the case. What if you have no health care coverage? Before I get into the options for that, I highly recommend, if you haven't already, definitely go back and look at another video, which I'll be sure to link up here. Tips for the uninsured is very, very useful information. I include lots of resources for people who are uninsured. Going back to the prescription coverage, here, what you definitely want to understand is that there are a number of different options that possibly you may be able to look into in the event that you have no insurance. Your prescription coverage is limited. You could actually talk to your provider and see if they have samples. Providers have samples all the time from drug manufacturers. I feel like this is kind of taboo to talk about, but it really is a situation where doctors have like loads of medication just sitting in their office, not even being used. So why not ask your doctor and say, hey, look, I'm not able to get this medication. It's so expensive. I can't afford it. What's the alternative? Do you have some samples that I could maybe use? And then while you're doing that, you can perhaps look at some alternatives, which again, as I said in the tips for uninsured video, there are definitely some tips and some ideas that you could look into in that video. But also, in addition to that, recently I've been noticing this commercial for this program called GoodRx. This is not an ad. They're not sponsoring this video, but I've been noticing the commercials. And so I looked into it, and basically what it does is it allows you to look into different pharmacies in your area and finding out where a particular drug may be cheaper. So it helps to cut on costs, it seems. I've never used it. I don't know anyone that has used it. So again, I'm not privy to exactly how it works, but I will say that I've noticed this commercial quite a lot. So why not look into it? Maybe it's an option. And I want to highlight that it is not a drug plan. It's just a tool that you can utilize to help you compare and see where a coverage might be cheaper. So definitely explore that, and I'll be sure to link it below. There's even an app that you can download apparently that is supported, and so you should for sure explore that. Which brings me to my next point, a website that I am very, very, very familiar with, that I use a lot and I refer to people all the time to look into it. So it's called rxassist.org, and what I like about this website is that it's offering you the number of different prescription assistance programs that may be available for a particular drug. So for example, we go on the website, you put it in, there's two categories. One is for the healthcare professionals, the other side is for patients. And as a healthcare provider, as a healthcare professional, I'm going to put in the drug, let's say it's Xarelto. I put that in, and what that does is it gives me the list of different drug programs that exist for this particular drug. So you can look into that and see and determine whether or not you may fit that category or the criteria that's required. And they usually ask for income and things like that, and you do need a prescription, of course, because you can't just call these manufacturers and expect them to give you the medication. But what they do is they may be able to get you some of the medication for a certain length of time. Some of them could be 6 months, 3 months, a year, and basically it is through the drug manufacturer where you're able to get this medication. I'll be sure to leave all of the resources for all the items that I mentioned in the link down below. Now, if you've ever been in a scenario where you were unable to get prescription coverage, comment with the word listen below so we can connect, because I'd love to hear about that experience. If you like this video, be sure to give it a thumbs up. Again, if you haven't, make sure that you subscribe so that you can be notified as to when I upload a new video. And thank you so much for watching. stay tuned for the next video. Oh, and also if you have some suggestions of things that you want me to cover or talk about, be sure to let me know in the comments and I'll see what I can do. Thank you so much for watching.